all of you, you are knowing, uh, you are having a better knowledge of this IMS specialist one role. The job description already we have mailed, and I'll request all of you to be give your 100%. If some confusion, something is there, you can clear that confusion. And I will request Sadaf ma'am to start the session.
Thanks so much, Rahul. It's a lovely introductions and nice meeting you all. I know it's an afternoon after lunch, so I don't want anyone to sleep. And of course, I want this session like quite interactive. Okay, I don't want that only me were talking in the session, because of course the motto of the session is to understand and to clear all your doubts and to clear how you want to pursue your further career on the payment thing. So I want as much questions you can ask, try to whatever question is there mind. No question is like a stupid question or something like that. Don't feel that. Please do not hesitate, ask any type of question with me. Okay, so I'm very much happy to answer your all queries. So first thing, I want to introduce myself. Okay, so my name is Sadaf Sheikh. I'm having experience in clinical research is more than 15 years. So to my career growth, I started my career as a clinical research coordinator. You all know, right? What is clinical research coordinator? Say yes or no.
Yes, sir.
Yes.
Hey, very low voice. जोर से बोलो.
Yes,
Yes.
ma'am.
Yes,
Yes,
sir.
Yeah,
ma'am.
Yes,
this is
ma'am.
this is this is what I want. Cool. So I started my career with a clinical research coordinator, and I work as a coordinator for a 2 year. And believe me, when I have joined that course, uh, I have join as a, because you are in a very right organization right now with a very safer hand. Rahul and Kamal, they are doing excellent job. But when I have joined started my career as a clinical research coordinator, no one has there to guide me. So you should very much thankful to Rahul and Kamal for giving you this placement opportunity, at least because I am for belong from Indore. I have completed my post graduation from T. John College, Bangalore, where I have pursued my career. I want to pursue my career in clinical research, so I have joined the course from Pune University, but I have not get any assistant for the placement. Okay, so what I have did, I came back to my hometown Indore. At that time, it is very naive course for the. I'm talking about in 2008. Okay, 2008. I'm talking about. So then I have myself approached to the hospital. Right, I used to sit three hours in the hospital to schedule my interview. I was begging them, yeah, please schedule my interview. I want to join as a coordinator in the hospital. Then finally I got selected in one of the renowned hospital in Choitram in Indore as a coordinator. And believe me, the pay was not good at all. It is like you are right now what you people, the Rahul and the Kamal, they are, trying to give you as much you can. But believe me, my starting pay is just 3,000 rupees. Okay, so but I take that as very positively manner. I thought, no, this is like something uh like I want to learn in this field, and these people are providing me the fee for that. So I have taken that thing in a very positive manner, and I started my career in a very basic. Okay, so in that hospital, no facilities, nothing was there. I have organized everything. I myself contact the contract research organizations through LinkedIn, did my feasibility, started my project there in the hospital. So I myself have did set up the complete research department in that multi-specialist hospital. You can even search in Google Choithram Hospital Indore. Okay, from ethic committee to everything, I did the setup. So I have spent quite 2 years in that career and in that salary. So you people, I'm Rahul. I want to say that I'm literally, hats off to you and Clean Mind. You are providing these students a brilliant opportunity. Like if this type of things is there in my time, I was like obliged like anything. So yeah, you are doing great job, Rahul. So then after 2 years, I have shifted my career. I have got selected with Biocon. You know Biocon, right? Everyone heard the name Biocon? Yes, no.
Yes, ma'am.
Cool. Yes. So I got selected directly as a CRA2 position in Biocon. That is also by myself. Okay. And then my career like boomed like anything. And right now I am a manager in multinational company. Okay. So for you people, I want to say that you are the luckiest people. You have the placement assessments, you have the separate placement desks who are working day and night to get you the placement. So yes, so this is about nutshell. Like I started my career as a CRC, then CRA2, then I was a senior CRA, then I was a CTL, then associate project manager, then manager, and right now I'm a manager position handling the team of 25 people who is like PhD doctors. So this is about me. So Rahul, can I share my screen?
Yes, ma'am.
Okay.
Gauri ma'am, you have given the right to Sadaf ma'am?
No, I have not given right. Can you?
You're not having presentation rights.
No, I don't have a presentation. I'm not able to share it.
Gauri ma'am, you were there in the session?
Yes, I'm there.
No, Gauri ma'am.
Sorry, ma'am. Okay.
Yeah,
Okay.
she is managing all this. Let me call her. Give me 2 seconds, ma'am.
Yeah, no issue, no issue. So before starting my session, I want you people to introduce yourself, and I want certain points to understand from you, and then I want you to speak about like what doubts you are having. Okay, and then eventually we'll start with the job descriptions which Rahul has provided, and I will explain you a bit about it. But believe me, I am not believing on the PPTs. I am believing more on interactions. Okay, so please and if you are not speaking, I will call out your name and I will ask you to speak. So yeah, be prepared that. Okay. Rahul, I think I have the rights. Just let me know once you're able to see my screen.
When you are having the rights?
Yeah, just let me know once you're able to see the screen.
Yes, we are able to see the screen. Now.
Excellent. Okay. So my first slide say, wait a minute. Introduce yourself. So I want you people to introduce one by one to me. Okay. So should I call out the name or how I will go? On my behalf, Rahul, please can you call out the name, because I have did it in the presentation mode, so I'm not able to see their names.
Okay, ma'am. No problem.
Yeah. So how you want to introduce? I want you have to call out your name, your qualification, your career growth, why you choose clinical research as your career, your passion, and your dream job. So I want these points should be covered in your introduction. Okay. Yes. Rahul, please call out the name.
Ayushi. You are there, Ayushi? Yes.
Yes, sir. Yes. Good afternoon, sir. Good afternoon, ma'am. My name is Ayushi. I have done my B.Pharm from Dr. APJ Program, Technical University in year 2020 within CGPA of 8.4. And after my graduation, I had joined medical summarization field as a senior associate where I worked 1.3 years. I worked there till
You worked
September.
as?
No, ma'am. Currently, I am not working.
No. Yeah, continue.
Yes, ma'am. I worked there till September 2022.
Azhar, what was the position?
Ma'am, on senior associate position as a medical summarizer.
Okay, so what is your job responsibility there?
Ma'am, we used to summarize the data like the test reports and history of the patient, medications, and all the related data, patient-related data. Yes.
Wow, so this is related to clinical research only. Good. Yeah, go ahead.
My aim to choose clinical research as a career is because when I joined medical summarization field, COVID came and medical summarization opportunity was there, and I grabbed that opportunity. And after working there, I feel like the growth and learning is limited. So I choose, and now the COVID has been gone, and now I think to switch my career in clinical research because it is one of the most growing field uh,
Mm-hmm.
in this investment.
Okay. And
And
then what is your passion?
yes, ma'am.
Anything.
My passion is to work for the human welfare, to generate the awareness among the people regarding the clinical research and regarding the drugs and their safety.
Excellent. Okay. And what you think, what is your dream job? Like how you, if somebody asks you, okay, what is your dream job? So what will come in your mind?
Ma'am, I my dream job is to set on a manager level and handling some important projects for the company and work for the growth of the company.
Excellent. So right now you are having the 1.1 like
3 years.
1 year 3 years of
Yes,
experience
yes,
there.
ma'am.
So I think you are on the right track. I forgot your name. Can you tell me your name again?
Yes, ma'am. My name is Ayushi.
Arusha. Okay. So
Ayushi, ma'am.
Ayushi. So
Yes.
Ayushi, first thing, the corporate rule is you shouldn't tell anyone ma'am and sir. Okay. So you can call me very much Sadaf. It's okay. Okay. So yeah. Now coming back to your dream job, which you said that you want to become a manager. So you are very much on the right track because you're already having a 3 year of experience, and this is really value added in your CV. Okay. So yeah. Thanks so much for your introductions. Rahul, next candidate, please.
Soumya Jaiswal.
Thank you, sir. Thank you, ma'am.
Yes, Somya.
Good afternoon, ma'am. Good afternoon, sir.
Good afternoon.
Myself, Soumya, and I am from Lucknow, Uttar Pradesh, and I have completed my Bachelor of Pharmacy from AKTU University, Lucknow in 2022. And recently, I completed the course Advanced PG Diploma in Clinical Research and Pharmacovigilance from Cliniminds. And I am choosing the career as a clinical research because clinical research and pharmacovigilance is a very growing field and concerning with the safety of the patients and research innovations and contributing toward the global health. So that's why I'm interested in this field.
Mm-hmm.
And I'm
What is your
talking about
patient?
my
Yeah.
um, ma'am.
You are not well.
No, ma'am.
Okay. Don't get scared. Okay. just
Yes,
just
ma'am.
be bold and speak without hesitation. This is what we required. Confident. Okay. Yeah.
Yes, ma'am.
What is your patient?
Um,
You don't know your patient. Drawing,
to
dance,
no, ma'am.
fitness.
Become a good clinical coordinator and clinical uh, research associate.
How boring.
And
You don't have any hobbies?
ma'am, creative arts, including painting and crafting.
Wow. So we have artists also. Good, good, good. And how about your dream job?
Ma'am, to become a
Yeah. You're there?
yes, ma'am. Yes,
Yes, yes. Tell me, what is your dream job? What you think, like when when somebody say that what you want to become? ऐसा होता है ना बचपन से we were thinking कि हमें ये बनना
yes,
है. So
ma'am.
what was your dream job at that time? No idea?
No,
Okay. No worry. Yes. Next, Rahul. Thanks so much. Yeah, next. Rahul, you there?
Oh, I was trying to unmute. I was not able to.
Okay, no waiting.
Nikhar Gupta.
Yes, good afternoon, sir. Good afternoon, ma'am.
Yes. Nice to see you, Nikhil. Yeah.
Please start, Nikhar.
But you're not audible.
Please start. Start your introduction.
Yeah, yes, sir. My name is Nikhar Gupta. I'm from.
Hmm.
Yes, sir. Yes, sir. My name is Nikhar Gupta. I'm from Ghaziabad, UP, and I have completed my post graduation in medical microbiology from Maharishi Markandeya University, Ambala, in the year 2020, and I have completed my graduation in medical microbiology from HNB Gadwal University, Dehradun, in the year 2017, and I have done clinical research and clinical data management course from Cliniminds Institute. Uh,
Yes.
that's it, ma'am.
And what
About
is
myself?
yeah?
And regarding my career goal, as I'm a fresher and I haven't worked anywhere, so right now I want to get placed in one of the reputed MNCs. And
What was your passion?
my passion, I would say that uh, I work hard in whatever I do. Like I love traveling, and I love cooking food.
Wow.
I just want to make people happy in whatever I do. And regarding my career, I want to just work hard and reach at a position where I can make the life of the people better.
Great, Nikhar. So, what all places you want to visit? You visit mountains or you visit seas?
Ma'am, both I would say.
Okay, good,
Yes,
great.
ma'am.
Nice to know you, Nikhar. Next,
Thank you so much, ma'am.
Yeah.
Shubham. You're there, Shubham?
Yes, sir.
yes, Shubham.
Sorry, sir, I am unable to mute.
I have a right to mute you. Yeah. Yes, Shubham.
Yes, ma'am. Good afternoon, ma'am. Good afternoon, sir. Sir, ma'am, my name is Shom Bardwaj. I'm 23-year-old. I have completed my graduation in pharmacy in 2021, and I have 8 months of experience as a clinical research coordinator.
Wow.
And
Where you
currently, I have,
working as a coordinator?
ma'am, Dhanvantri Hospital and SCG Cancer Hospital, Jaipur.
Jaipur.
Yes, ma'am.
Excellent. Yeah.
And currently, I'm pursuing post-graduation diploma in clinical research and pharmacovigilance from Redhead Institute, Clinimind, ma'am. And currently, also, I'm finding a job in clinical research and pharmacovigilance. And if I talk about my hobbies, I love to do singing, playing guitar, playing chess, ma'am, and love to talking about clinical research, ma'am.
Wow. Okay. And what is your dream job?
Ma'am, my dream job would be, ma'am, I want to become a manager, ma'am, where I am working. Ma'am. Where
Okay.
I will work, ma'am.
Manager. Nobody is saying director or head or VP. Everybody is like manager. Yeah. Good. Yes. Thanks for introduction, Shubham.
Thank you.
Yeah. Rahul, next.
Yeah, Shubham, one correction from my side. What you're saying, pursuing. You have completed the course. You're not pursuing.
Yes, sir. Yes,
From subconscious, you have learned pursuing. You have completed the course.
yes, sir. I have completed my
Yes.
post-graduation.
Samriddhi.
Yes, sir.
Yes, go ahead, Samriddhi.
Good afternoon, ma'am. Good afternoon, sir. Myself, I am Samriddhi Kulkarni. I have completed my master's in biotechnology from Usmania University in 2021. and I have also completed my PG diploma in clinical research and clinical data management from Cliniminds, Noida. And
Mm-hmm.
talking about my hobbies, I love singing, and I also do painting and drawing.
Mm-hmm.
And my dream job is to acquire a highest position in an organization, so
Mm-hmm.
as to help the to contribute in the growth of the organization and as well as
Mm-hmm.
mine.
Oh
Thank
wow, that's really good. And what is your passion?
you.
What do you
I
like to do free
I
time?
like to help people.
Okay, what type
So
of help you did you join any NGO or something?
uh, I was not a typical NGO, but I was here in my hometown. There was a sort of a short meet of or you can say a summer camp. So
Mm-hmm.
there I just volunteered.
Wow, that's really cool. Thanks so much, Samruddhi.
Thank you, ma'am.
Yeah.
Anand.
Anand, we are not able to hear you. Yeah.
Yes, sir. Good afternoon, sir. Good afternoon, ma'am. Thank you for this opportunity. My name is Anand Kumar. I hail from Bihar. I did my bachelor in B Pharmacy from Noida Institute of Engineering and Technology in 2021. I recently completed advanced post-graduation diploma in clinical research and pharmacovigilance. And my interest is playing badminton and photography and cooking. And my goal is to join a corporate field. And my passion, if I got opportunity in CRC, then after the 5 year of experience I want to become a CRA. That's all about me, ma'am.
Okay. But for your information, Anand, I become a CRA after 2 year of experience and then to directly as a CRA too. So you don't have to wait for 5 years.
Okay, ma'am, I will be blessed, ma'am,
Yes.
if I.
Yes. It's only your hard work, your power of
Yes, ma'am.
learning. Okay.
Yes,
Yeah.
yes.
Pradyot.
Thank you, ma'am.
Thanks.
Good afternoon, sir. Good afternoon, ma'am. Hello.
Good afternoon. Good afternoon. Yeah.
I am Pradeep Kumar Sai. I am from Nayagarh district, Odisha. I have already completed my bachelor in pharmacy in the year 2021, and after that, I completed postgraduate diploma in clinical research, pharmacovigilance, and also clinical data management from Clinimed in the year 2022. After that, I looking forward any opportunity in the field like that, clinical research, pharmacovigilance, and clinical data management. My passion is more learn about and more explore about like in clinical research in that field. Uh, my hobbies is playing cricket, playing more game like badminton.
Mm-hmm. And what is your dream
Uh,
job?
my dream job is become a clinical data manager.
Data manager.
Yes, ma'am.
Okay. Good. Yes. Thanks so much, Pradyut.
Priyanka
Okay,
Shinde.
ma'am.
You're there, Priyanka? Yeah, good.
Yes. Good afternoon, ma'am. Good afternoon, sir.
Good afternoon.
My name is Priyanka Sunil Shinde. I'm from Pune, Maharashtra. About my qualification, I have bachelor's degree in pharmacy from Dibatu University in year 2022. Apart from that, I have also done advanced postgraduate diploma in clinical research, clinical data management from Clinimind Institute. And I'm currently looking for a job in clinical research field, and my dream job is to get a job in a managing position, and I'm passionate about gardening and traveling. That's
Wow, that's good. So the people who are saying that they are passionate about traveling, just for your information, I am a solo traveler and I used to travel every month. So yeah, it's good. Traveling is good. Yeah.
Thank you, ma'am.
Thanks, Priyanka. So we
Harendra.
are, yeah,
One more. This is
Yeah.
He's the last one.
Okay.
You're there, Harinder?
Hello. Hello,
Yeah, Harinder, you are audible.
Yeah.
sir. Good afternoon, ma'am. Good afternoon, sir.
Good afternoon.
Thank you for giving me this opportunity to introduce myself. And my name is Harinder Singh, and I am from Faridabad, Haryana. And I am a B Farm graduate. Completed my graduation in 2022 from B.S. Sananpuri Institute of Pharmacy. And after that, I have completed a advanced postgraduate diploma in clinical research and pharmacovigilance, where I have learned about the basics of clinical research and pharmacovigilance and what softwares are used in clinical research and pharmacovigilance. That's all about my qualification.
What about your patient?
But ma'am,
What is your patient?
I am passionate about for cooking. My
Okay.
passion is to open my own restaurant.
Okay, that's good. And what is your dream job?
Right now my dream job is to become a pharmacovigilance associate or a drug safety associate.
Mhm. Okay, good, good. Thanks so much, Harinder.
Yeah, thank you, ma'am.
Yes. So thanks everyone for your lovely introductions, and I'm so happy that the way I'm so felt good hearing about your patients, your career goal, and I'm hoping that you will all get that your career aspirations. So now coming back to the our session, that the motto of our session is to answer your queries and to remove the doubts which you are having in your mind. So I am giving the session over to you people. Please ask me question, and then I will take you to the introduction about the investigator grant payment. Okay, so yeah, over to you all. So please raise your hand and then ask the question. What doubts you are having about the profile?
Please feel free if you are having whatever doubt you are having.
Yeah, and don't think like how you will look while asking this question or something like that. Please, even it's a silly question, please go ahead and ask. So I will call out the name Rahul in that case. Is it
Okay,
fine?
ma'am.
Yeah. Okay. Yes. So Priyanka, I'm starting with you. Tell me what doubts you are having with regards to profile and any confusion in your mind.
Yes, ma'am.
Yeah.
Ma'am, it's role about the payment. So it's the role of the finance department. So what
No,
will be the role of
you are wrong here. Who
uh,
said it's a finance department role?
ma'am? It's in job description. It is about role.
No, no. First of all, this role is not about the finance department. Of course, the payment role, the investigator grant payment role, it's related to the payment, but this is not related to finance. So please clear this from your mind. So before going ahead, do you heard about what is CTMS? Yes, no.
Yes, ma'am.
Do
Yes,
you heard about ECRF?
yes, ma'am.
Yes, ma'am.
Okay.
Yes,
Do you heard about the clinical trial contract, CTA?
Yes, ma'am. Yes, ma'am.
Yes,
yes,
ma'am.
ma'am.
Okay. So do you heard about something called subject visit? Yes, no?
Yes, ma'am.
Yes, ma'am.
Yes, ma'am.
Okay. So to clear your doubt, the investigator grant payment, of course, it's related to finance, but it's not only purely finance. There is a huge scope in a clinical research for this special department. Okay. So where I'm working, they're also we have a separate department of investigator grant payment, and we are only recruiting the life science people. Why we want life science people and clinical research experience people? You know why? Any idea? Do you think if I take someone from commerce background or someone from accounting background, are they able to see how many subject visit has been completed, how many essays has been updated, how the CTMS is completed? Are they able to understand that? Yes, no.
No, ma'am.
No, ma'am.
Then who said this is the finance department? So Priyanka, to your question, this is not related to finance department. This is a very crucial department who is taking care of investigator payment as well as the site payment. But it's not like कि आपके पास invoice आई आपने बनाकर भेज दी. No. The depth of this role is why we want a life science people here. They will go. Okay, they will go in the CTMS, they will go in the ECRF, they will check that how many ECRF pages has been completed, how did the CRA has reviewed all the CRF page and logged it, did the PI sign all the CRF pages, did the CTMS completed with the monitoring status, and then they will generate a batch. What they will generate? Batch. Okay, and once they generate the batch, they inform the finance department the batch has been generated. Now you will do the invoice for the PI payment. Okay, so you are the people who is going to review the data before finance team will making any payment, because you are reviewing that whether the subject visit has been completed or not, whether PI did the signature or not, whether the data has been entered in the ECRF or not. Okay, so Priyanka, to your question, this is not a finance job.
Okay.
Am I clear here?
Yes, ma'am.
Cool. Next question, please. Pradyut.
Yes, ma'am. If the
Yeah.
recruiter asks, why did you choose that type of role? So what will be the appropriate answer for that, ma'am?
If recruiter asks that why you have choose this role, you can say that you want to pursue your career in a clinical research, and to start with, definitely I want to choose this role. Because starting off this session, you remember what I said, what role I was chosen to enter in a clinical research, a coordinator role, and how much salary
Yes, ma'am.
I was getting 3,000. So you have to start somewhere. Okay, and right now you people are freshers, so it's not like, and again I'm saying Rahul is doing a great job to giving you the platform, and then to an opportunity for the multinational company. If I would have in your place, I should have grabbed that, because the struggle which I have taken to to enter, at least to enter in clinical research, it has taken 1 year for me after completing my course. So you are the luckiest person, I can say. So Rahul, if you don't mind, is that all students has been selected, or
No,
how
ma'am.
is it?
We have forwarded their CV.
Mhm.
Syneos approached us for this position. Then
Okay.
maybe next week they'll be appearing for the interview.
Okay. Great. 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 So
So we thought they should not go with any confusion
no,
or
no,
query.
no, 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 no. That's what I really want to appreciate you, Rahul, and I really want to thank you that you are taking care of their career so well, that you had provided them an opportunity at least to enter in the CRO, because entering in a CRO and then to through a clinic, with the placement, it's a like, it was a dream for me, but unfortunately I have struggled myself. So Pradyut, when the interviewer will ask you a question, first of all, Pradyut, have you done any job before?
No, ma'am. I'm a completely fresher.
Okay, so to start with, you can say that I want to take this opportunity, and this is a CRA role, a CRO of a clinical research organization, and definitely I look forward to grow here. Okay, and once you enter to any company, not on the particular company where Rahul, if Rahul is suggesting any other company also, so once you enter into the company, right, you have hell lots of opportunity, not only on the same I can say For an example, if you are giving an interview, investigator grant payment, if you worked 3 years as an investigator grant payment associate 1, 2, 3, and if you want to pursue your career in other different role also within a company, you can apply it. You know that? How many know that?
Yes, ma'am.
Right? So first thing, keep in your mind, being a fresher, entry in the CRO is very much important. Once you get a tag that you have worked on so and so in particular CRO, this itself is a very much give a weightage to your CV, Pradyut. Okay,
Yes, ma'am.
so don't make a choice, especially as a fresher. I always suggest all my freshers student, don't choice make a choice between the job. No, I want to do this. No, I want to do that. No, whatever is coming in your way, grab it, and see that how you can utilize this opportunity to boom your career further, and how you can take this ladder to move your career further as per your the dream, like what dream you have chosen. For an example, right now they are taken as a grant payment 1, then after 2 year or 1 year they will promote as a grant payment 2, then grant payment 3, then they will be associate manager, then director. So there is it's a different ladder. And if you are think that in the grant payment you want to explore some other field, so within a senior you can apply in the CDM department. There is a monitoring department, there is an medical monitoring department, pharmacovigilance department, safety department. And you know what, first when any vacancy open in a company, any CRO, any MNC, they will check with the internal people if they want to move internally. You know that? How many know that? How many know this fact? Like, yes, no. You
No,
know
ma'am.
that? Yeah. So you can move out diagonally. So first thing, keep in your mind, whatever opportunities coming in your way, at least do the interview and grab that. Okay, because nobody will come and tell you, okay, please, this is your choice of job, please come and work in our company will get lots of candidate. Okay, but it is
Yes,
very difficult to enter in the company first. And again, I'm repeating the same thing, Rahul, sorry, I'm calling your name again and again, but yeah, he is actually providing a great opportunity. At least you people as a fresher, you can entering in a number 1 CRO right now. So please do not lose this opportunity thinking that this is a finance job. No, it is not finance job. And I'm going to take that session also. Okay, so yeah, hope Pradyut I am answered your question, right?
yes, ma'am. I got it. Thank
Yeah.
you.
So when to all of you, when the recruiter is asked why you are interested in this role and have you learned about this role, so say yes, I have learned about this role because this is very much related to payment. We know that, but before giving any payment to the investigator, to any hospital, or releasing any payment, there is a role called a associate role where we have to check the ECRF, the CTMS, and confirming the completion of their task, the monitor task, and then only the invoice we will generate, and then it will be sending to the finance department. So here we play an important role, checking the complete data from the ECRF, from the CTMS, and informing the confirming the finance team to generate the payment. Okay, so this should be your answer. Okay,
Yes,
am
ma'am.
I clear here? Yeah. Okay, so Nikhar.
Yes, ma'am.
Yes.
Ma'am, I want to know that we can move. As you have told just now, that we can move to any of the department after this.
Yes.
But I want to know what are the senior positions after this IMS specialist role in this
Senior
department
position, I
only.
just tell, like, if you are joined as an investigator grant payment associate 1, then eventually with your performance or how much hard work you are doing, you will get promoted as a 2, and then there is a ladder for associate manager, and then it will become a senior manager, then it will become associate director, then VP and head. So it's like that. And if you want to grow diagonally with the other positions, you can very much apply to it.
Yes, ma'am.
Yeah.
And ma'am, also that what all the things, all the job roles which are done in this role.
Mhm.
So, ma'am, those are also done by the CRC also. That CRC also helps with the budget and with the
No, no,
verifications of
no,
that.
no, no,
No, ma'am.
no.
So it's a completely a different job role.
Yes, CRC only do the entry in the, see, when you become working in a CRO, forget about the site. Site is one site, but CRO is handling the sites. So when you become a
Ma'am.
grant payment associated, you are not concentrating on one particular site. You have to take care of all 500 sites there on for the project, particular project, or all 200 sites is there for the particular project.
Okay,
And
ma'am.
what role CRC will play here? See, or this is not also, you also don't have to coordinate with the CRC. If there is, if you see, suppose CRA come to you and say that, see, I have completed the monitoring visit, please check the ECRF and generate the invoice. Okay. So first thing, when you are seeing the ECRF, if it's not completed, okay, so first thing, when you are generating the payment, ECRF and CTMA should be completed. If it's not completed and monitoring has not done, then you are not supposed to release the payment. Okay. So in that case, you will write back to CRA and say that the monitoring has been not done. The CRC has not updated the ECRF. Now CRA will follow up with the CRC. Okay, please complete the ECRF pages.
Yes, ma'am. Yes.
Okay, so you are not working as a CRC there. Sorry, you are handling around 200, 300 sites, and then too, it's not in India. Global, I'm talking about. So this is a very great opportunity that you are interacting with the different countries, people, and the different culture people, where you can say China, Japan, Taiwan, US, UK, Canada, North America, America, every country payment you are doing here sitting in India.
Yes,
Getting
ma'am.
my points? And just see the broader aspects, like, you know, CRC, suppose sitting in India, you are connecting with the different people globally. So this itself is giving you so much of exposure, where, you know, you are knowing that how the people from America were working, how the Canadian people were working, how the you know, Taiwan people were working, how China, Japan people were working, who is the difficult. So this is a great opportunity for you. That's what I want to say. Okay, so
Yes, ma'am.
yeah, you will understand the different culture of the different countries here.
Yes, ma'am. Ma'am, I was thinking only about the one side, but it's on a broader
No,
aspect.
yeah, like sitting in India, you are generating payment for America, you are generating payment for New Zealand, you are generating
Yes,
payment,
yes.
and then you are coordinating with their CRAs also. For an example, their particular project where they're having a multiple site globally, so you are connecting with all the CRAs. Like, for an example, there are 1000 sites, okay, globally. So all the countries CRA you are connecting with, you are attending the global call also. So just think on that, you know, broader perspectives. Okay.
Yes, yes,
Yeah.
ma'am.
I hope I answered your query, Nikhar.
Yes, ma'am.
Cool.
Thank you,
Okay.
ma'am.
No issue. Ayushi.
Ma'am, I want to know if the recruiter asks, like, why you want to join Syneos.
Ayushi, I'm not able to hear you.
Ma'am, am I audible?
No. Can you be loud?
Yes, ma'am. Ma'am, now am I
Yeah.
audible? Yes, ma'am. Ma'am, I want
Still,
to.
Ayushi, you're not audible.
Sir, I'm reconnecting.
Okay. So any Shubham.
Yes, ma'am. I don't have any doubt, ma'am. I was thinking that this is related to finance, but I am clear.
No, it is not related to finance at all. Okay. Soumya, I think you shared your doubt, right?
Yes, ma'am.
Okay. And then we have, I'll pick a name from here.
Ma'am.
Huh?
Ma'am.
Ayushi, yeah.
Ma'am.
Yes, Ayushi.
No, ma'am, it's Soumya.
Sorry?
Ma'am, it's Soumya, not Ayushi.
Okay, yeah, Soumya. You want to ask something?
Yes, ma'am.
Yes, go ahead.
Ma'am, IMS specialist, how to deal discrepancy and what should we do?
Sorry?
Ma'am, IMS specialist, how to deal discrepancies and what should we do?
I'm not able to understand your question. Rahul, are you able to understand? IMS specialist. After that, your voice is a bit shaky. I'm not able to get.
And maybe she is talking something to the job description.
Okay.
Yes, sir.
And you're having the job description with you, no?
Yes. Kamal has shared with me. Yeah, tell me what you were asking. Just give me a second. I'll let me open that job description. Yeah. What was it?
Ma'am, IMS specialist, how to deal discrepancies and what should we do?
Discrepancies. Okay. So
Yes,
first
ma'am.
thing, you only answer me this. Okay. So you know that there is something called clinical
Well,
trial.
can we go through this job description point wise so that they are knowing everything about the job description?
I have not put it into the PPT, Rahul, considering it's a confidential thing.
Oh, okay.
Yeah, if you can share your screen on that email, that will be helpful.
Okay. I'll try for that.
Yeah. So, Soumya, you tell me, like not only Soumya, but anyone can tell me. You know about something called clinical trial agreement, right?
Yes, ma'am.
Yeah. So, what it contains? Any idea? The person who's working as a CRC, he can tell. What was his name? I forgot. Who was working as a CRC in Jaipur? I forgot his name.
Yes, ma'am. Shubham Bhardwaj.
So Shubham, yeah. So what CTA is contained? Like
It is an agreement between the site in the site and CRO, ma'am.
okay, so what is described in contract? What they described?
And the main thing is confidentiality, ma'am.
And
And ma'am, how long the clinical trial will be conducted in the site hospital?
and you are missing the main point.
And ma'am, about payment related, ma'am.
Correct. So it contain how much PI got per patient visit. For an example, I'm just giving an idea. Okay, this is just an example. I'm not quoting any CTA here. So for an example, if PI, I'm talking about Indian currency. Okay, so for an example, there is a cardiac study in the CTA. It has been described that per subject visit. Okay, per subject visit. If one subject is recruited and they completed first visit, okay, after screening, randomization, and first 3 visit, if they completed, PI will get the 50,000 rupees. Okay, how much, Soumya?
50,000 rupees.
So now the CRA will go to the site. He or she will check inclusion exclusion criteria. Screen has done. ECRF has been completed, and the CTMS is completed with the status that SDV and SDR. SDV, you know what is SDV? Source data verification and source data review, right? You know that.
Yes, ma'am.
Okay, so CRA will do the SDV and SDR, and then they will come to Soumya. Okay, Soumya, I have completed this subject. This is the CTA. This is the payment you need to generate. Okay, so suppose for an example, there is a 50,000 has been updated, or like 40,000 has been updated by mistake by you or by the CRA. So here what you are supposed to do, you have checked with the CTA. That CTA is the clinical trial agreement, that how much payment has been committed for per subject here. Okay, and then you can update it accordingly. Again, this is one query. Again, when CRA is saying he or she has completed the you need the right, Rahul?
Yeah, I don't have screen sharing right.
No, you go to window. I did the same thing. So you go a window. The option is coming.
Okay.
A window. Yeah. So Soumya, for an example, if CRA is saying that he or she has completed the SDV and SDR, but once you are going in the CTMS and seeing that the SDV SDR status is still showing in progress, So that is again the one query you can generate. That still is in progress. I cannot generate the payment because here is showing in progress. Okay. So first thing, you have to check whatever the CRA is saying to generate the invoice from the CTA. You have to cross verify with the ECRF and the CTMS and other tool also. I'm talking about other tool in the sense there might be other tool also, depend on the organization to organization, which they will ask you to cross check. Okay.
Okay, ma'am.
Okay, in that this way you can clarify again. When I was doing this responsibility, lots of query will be on the PAN number. You know, sometime the TAN number will be there. PAN, it depend on country to country regulations. Okay, so they have, like in India we have a PAN card number, right? So similarly, sometime that number is not correctly mentioned in the CTA, and hence the payment is not generated correctly. In that case, you have to connect with the CRA and take the correct number, or you can ask the CRA to provide the copy of PAN card to cross verified it. Okay. Similarly, the payee name. Okay. So there are lots of things, you know, which you have to cross verify it. So before I start, can somebody tell me how many type of CTA is there? You must be, you know, learn from this course, yeah, like type of CTAs. Shubham, you have any idea? Shubham already left the meeting. Okay. So there are different type of CTA, bi-party, tri-party. Okay. And sometime when the sponsor has been involved, so there are 4-party CTA. Okay. So bi-party is between PI and the CRO. Tri-party is between PI, institution and CRO. Okay. And 4-party is PI, institution, CRO, and if SMO has been involved. Okay. So am I clear here?
Yes, ma'am.
Okay. Rahul, I'm able to see your screen.
Okay, ma'am.
Okay. So any question again? Should I pick the name? Harinder.
Yes, ma'am.
Yes.
Ma'am, actually, I have same doubt as Priyanka had. That is, what is the job role? It's related to finance.
No, it's not related to finance. So I think I have cleared your doubts, right?
Yeah, yes, ma'am.
Yes. Yes. Okay. Good. Anand?
Ma'am, I have cleared my doubt. But you can you brief me, ma'am, once again, please?
What you want me to
About the
brief?
job, ma'am.
About the job, what you have to do. Okay, so right now Rahul is sharing the screen for us. Okay, so here job responsibilities: managing investigator payment option on various CTMS tool like Impact, Medidata, and CliniPay. I had already told you, right? You have to cross check all those things, and this is not a responsibility of any other person apart of person who's qualified in a clinical research. Okay, so this is a very important thing. You have to cross check all those things. Reviewing the data with project manager for quality and competency. For an example, again, reviewing the data. What does mean reviewing the data? Again, checking the ECRF, CTMS, whether it's updated correctly or not. Okay. Processing and creating a grant payment request via CTMS tool and forwarding or interfacing with the account. Okay. So once you will check complete data in the CTMS, okay, CRF completed, SDV, SDR completed, the payment name updated correctly, then you can share the request to the finance department. Okay. Then distributing the investigator payment to the respective sites. Once it's been generated, you will generate something in the CTMS. Okay. So I'll just want to give you brief about the how we are generating payment in the CTMS. Once you land it into the CTMS, you will grant with the access called the investigator payment access, where you will generate the batches. Okay. So there is in the batches, once you generate the batch for that particular site, you will run that batch, and that batch code you have to provide to finance department that I have run this batch. This is the code. I have checked that all the payment related, like ECRF is completed, CTMS completed, please generate so and so dollars payment for this particular site with this payee number, with this account details. Okay, which you have to cross check again with the CTA. Okay, so exception is China side, because in that agreement will be in the Chinese language, so you have to cross check with the CTA, like can you provide this in the English language? If not, then you require the CTA translation in that case. Okay, fine. So Anand, am I clear here?
Yes, ma'am. I got.
Okay. So again, similarly, the facilitate the site payment internal groups such as clinical operation. Who will come in the clinical operation? CRAs, project management, account. Okay. This you have to coordinate with all these stakeholders. Collaborate with the account again. Create and maintain the reconcile. This you have to maintain in the access. Every company is having their own tracking system. Some they have the Excel. Some will have the macros. Some they have an internal, online tracking mechanism. So you will get trained. Don't get scared with seeing the job description कि इसमें से हमें कुछ आता नहीं है. The company is hiring a fresher. Reason behind, they will provide you the training as well, full-fledged training. First 2 months is completed training period for you. Okay, so you will be full-fledged with all this, whatever description is there, CTMS, impact, meditator. You will be full-fledged with all these trainings. Okay, so don't get scared saying कि ये तो हमें आता नहीं है, we don't know Excel, how to do it. They will give you the complete end-to-end training. Okay, so yeah, and again I'm saying, try to learn as much you can during your training time. Okay, ask the question. Here I'm calling out your name and asking you that please ask the question to me. There you have to take your own responsibility. Okay, please ask lots of questions with your senior, your mentor, your, once in again, when you appointed in any MNC, they will allocated buddy to you. What will this buddy will do? This buddy will help you to onboarding process. This help you to navigate you through all the company related policies and the process and all the things. Okay, so ask all the questions. Don't hesitate asking the questions. First thing, as a fresher, learn that ask the question as much you can. Okay, please do not hesitate asking the questions. Okay, so here we are clearing all the doubts, but once you are selected in that particular company during training time, please try to learn as much you can and ask the questions. Okay, yeah, fine. Any other question? Am I missing someone? Rahul, I hope I have covered everyone.
Yes.
Yeah, okay. So now coming back to the payment thing, I'm sharing my screen now, Rahul. You can stop sharing it. Are you able to see my screen now?
Yes.
Cool.
Yes, ma'am.
So investigator grant payment. Okay, so what is investigator grant payment? So I will not going to read this. Okay, now you tell what you have understand till now. Pradyut.
Yes, ma'am.
Yeah, you tell me what you have understand till now about the role which you are going to apply.
One.
Ayushi?
Yes, ma'am. Ma'am, I understand like that we need to care about the investigator and site payment and review the CTMS and ECRF and CTA documents and generate batch and inform it to the finance department.
Correct. So here, the investigator grant payments is service offering provider as a part sort of clinical trial services at high level and payment process being with agreeing payment terms, including budget as a part of contract of principal investigator. What is contract? CTA. Okay. Once the contract has been executed, each individual of site budget and pay who will be, because sometimes there will be the different contract. They will say PI ko alag payment chahiye, sub investigator want different payment, institution want different payment. So there are 3 contracts will be there. Sometimes all the payment will be go in a one shot. Like they won't say, they will say 10% will go to the PI, 20% will go to the sub I. It's again completely depend on contract. So which I say bi-party, tri-party contract will be there, and the 4-party contract will be there. Okay. So once the contract has been executed, each individual site budget and pay information can be entered in the clinical trial management system. What is clinical trial system? CTMS. Okay. And pay vendor details is also set up by the finance accounting system. So this all are system driven. You don't have to do anything. Okay. You don't have to do anything, like you are sitting with the calculator. I do understand, like once Rahul has been sent this job discovery, you must be thinking that we are sitting in the computer and then we are opening the calculator and doing this. No, this is completely automatic system where you have to recheck the systems and generate the payment batch. That's it. Okay. So there are 3 type of payment made by the grant payment team. Patient visit payment. What is patient visit payment? Payment that typically driven by achieving of milestone. What will be the milestone? Patient visit completion, such as completion of patient visit. Some countries also require an invoice to be issued. OOP, invoice payment, out of. Okay, payment based on invoice revised from site. Like sometimes site will provide the invoice. See, I have my site is completed so many of visits. You can generate the payment in that way. Payment based on invoice received from the site for the item listed in the site budget. For an example, that something called site selection visit, right? Yes, no.
Yes, ma'am.
Okay.
Yes, ma'am.
So during site selection visit, if for an example we are doing a cardiac study, okay, and we want a minus 70 degree of a refrigerator freezer there to preserve our sample, but the site is not having that particular refrigerator. So what as a sponsor will do, sponsor will give them a payment. Okay, fine, I will give you so and so dollars, please purchase that freezer. Okay, so that is will come at the OOP. So example, site setup cost, reimbursement of patient related expenses. Patient related expenses, for an example, we have a site in Medanta hospital, Gurgaon, and the patient is visiting from Jaipur. So their travel expenses. Okay. So that is also come under the OOP payment. Then we having a reimbursement local for an institutional review or ethic committee fees. You know that what is IRB IAC, right?
Yes, ma'am.
So they are not doing their job freely. We have to do the payment to them globally. Okay. It's not like only in India, but everywhere they ask for the certain amount of payment, which we have to give them. And sometimes we have to give the yearly payment also. Okay. And if after closeout also, we have to give them a certain amount of payment. It's depend on their SOPs. Okay. So that is also come under the OOP payment. IRB IAC fees. The payment made directly at the central institution, IRB board or ethic committee for the review or further services related to the study protocol. For an example, if new protocol already approved, the fees has been provided, but now there is an amendment of the protocol. So to review that amendment also, some IRB ask for the certain type of fees. Okay. So we have to cross check with the contract once the invoice has been come, and then we will approve that particular type of payment. Okay. Once payment has been initiated and approved in CTMS, the payment is proceed via financial accounting system. Okay. So once payment has been initiated and approved, who will do this? Who will do this?
CRO.
You. If you selected for this job, and then they will proceed to the finance department. Okay, you will initiate the payment, you will initiate the page after cross-checking all the systems. Okay, so the payment can be made via physical check or directly from the company bank account to the vendor bank account or via electronic fund transfer. Okay, am I clear here?
Yes, ma'am.
Any questions, any doubts? Okay, so now I'm stopping my screen because I want to speak to you all again. Okay, so now coming back to my questions again. So what you understand now till now? Is it clear? Do you think any third person who is graduate in commerce can do this work?
No, ma'am.
No, ma'am.
Ma'am.
Is it related to finance things?
No, ma'am.
No, ma'am.
No, ma'am.
Do anyone from outside like BCom or BSc, BCA person can understand what is ethic committee fees, what is protocol amendment, what is ISF fees? Do they understand that?
No, ma'am.
No, ma'am.
No.
So I think I'm clear here, right?
Yes, ma'am.
Cool. So I'm sharing my screen again. Just let me know once you're able to see my screen. Are you able to see my screen now?
Yes,
Yes.
Okay. So clinical trial agreement, coming back to clinical trial agreement. So this is the clinical trial agreement. What is it? A written dated sign agreement between two or more involved party to set out any agreement on delegation, distribution, task, or an oblige, and it, if appropriated on financial matter, the protocol may be served as a basis of contract. There are different type of two type of bi-party when agreement has been signed by sponsor and CRO, PI institution, tri-party when agreement has signed by the sponsor, CRO, investigator, institution based on change during the course of trial. Multiple amendment happened in the CTA. Why
Ma'am,
multiple amendment? Yeah.
your screen is visible, but the screen which is this Google Meet screen is visible to us.
Really?
Yes.
Okay.
Your
Let me-
PPT screen is
let
not
me-
visible.
Okay. Let me do it again. Okay. Mm, mm. Okay. Is it clear now? Let's see. Is it visible?
Yes,
Yes,
ma'am.
ma'am.
Okay, fine. So there are bi-party agreement and tri-party agreement. Okay. So now there will be the amendment of CTA also sometime. For an example, if the site is recruiting really good, and investigator wants to increase, per patient grant, so the CTA can be amendment. So because you all have graduated from cleaning minds, I want to ask you, when the CTA clinical trial agreement get amendment, do it require a ethic committee approval or notification? Yes, no?
Yes, ma'am.
Yes, got. Okay. To document the financial agreement between investigator, institution, and sponsor for the trial. So this is a clinical trial agreement in nutshell. Do you have any question on this? Anyone, even in silly questions, please go ahead and ask. No question? Yes, no?
Anything
No, ma'am.
should come out, yes or no?
Okay, fine. Cool. Okay, so this is clinical operation various function. So where I want to ask you, okay, all students, where you fit in here in this role? Yeah? Ayushi, Pradyut, guess bhi kar
Monitoring
sakte
side,
ho. You can even guess it. It's okay. Yeah, tell me.
monitoring side,
Where?
monitoring side manager,
Okay.
Project management.
Ma'am,
Okay.
project management and third party management.
Okay.
Vendor
And
management.
huh? Where?
Ma'am, third party management.
Third party.
Vendor.
Okay. Okay. So to all your surprise, where you know where you are fitting here, itself in a clinical operations role. So you are coordinating with everyone here. So this is the scope, like Here you are coordinating, of course, with the project management, data management. Why? ECRF should be completed. Medical management, if suppose AESAs has happened, the medical bills and everything, the AESA will be reviewed by the medical monitor, the third party vendor, the safety management, and of course with the site management. Okay, so you are working very closely with the clinical operation department and coordinating with everyone here. And that's the reason I told you, it's not like that once you are entering the CRO, your focus only will be with the, a grant payment associate. No, you are working with all the department, coordinating with all the department, and also not only in the organization where you are interviewing, and if you are selected, if you want to move out from one CRO to another CRO, that is also give you an important weightage if you are, spending your 1 or 2 year in that particular role. Okay, so this is how it is. Is it surprised? Yeah. Okay. So coming back to project management life cycle, you are already, understand this is a project management life cycle. So what your, once the study is awarded, your role is start from here, startup phase. Okay, because all the system and everything will be set up at the startup phase. Then the recruitment phase, when the subject visit has been started. Okay, so then ongoing basis the payment will start. Then the maintenance phase also, when the subject visit will completed, there started. And your main role will be done here when the full and final settlement of the site will be done during the time of database log. You have to check the complete SDV, SDR queries has been, there should not be no outstanding query in the ECRF. You should confirm that the all data has been freezed and has been signed by the PI, and then only the payment will be generated. The final payment will be generated during the time of closeout phase. Okay, so any questions here?
No, ma'am.
No.
No, ma'am.
Okay, so are you clear about the role, and are you clear about your scope moving forward?
Yes, ma'am. Yes, ma'am.
Yes, ma'am.
Yes, ma'am.
Okay. Okay, so this is all about the grant payment road. And again, I'm saying this is like a very crucial role, I can say. I'll try to show you something. Just give me a second. If I'm able to, just give me a second. So students, are you confident enough? Like if somebody will ask you what is your role when, if you are selected here, are you confident enough to answer that thing?
Yes, ma'am.
Yes, no. Yes.
Yes, ma'am.
Good. So you understand the role and the responsibility as a grant payment associate. Okay. But believe me, as a fresher, they will not going to ask you about the grant payment. Okay. So Rahul,
Yes, ma'am.
I want to touch base on how they have to, answer the particular questions as a fresher when the HR will ask them. Is it fine with
Definitely.
you?
Yes, ma'am.
Yeah.
Yes, ma'am.
Okay, fine. So for an example, when I'm taking an interview for the fresher, first question will be asked, introduce yourself. Okay. So please be confident when you are introducing yourself. Okay. Tell about your future plan. Okay, don't tell that I want to become a CEO of this company. No, please. Okay, tell that I want to look forward to grow on that particular field. Okay, and in a senior position I want to move when I'm selected in this organization. Okay, they might be asked you like what is clinical research. So that basic question, right? What is clinical research?
Yes, ma'am.
Yeah.
Yes, ma'am.
Yes.
Yes.
So what is clinical research? And they will ask you, do you know something about ECRF? What will be your answer? You know what is ECRF?
Clinic
Yes,
is
ma'am.
Yes. So you should say that whenever the visit is be completed, the visit will be documented in the source note, and from source note, what will be completing? ECRF. Okay, electronic data capture. Okay, and you know what is CTA, right? So learn about what is CTA, what is ECRF, what is CTMS. What is CTMS?
Clinical trial management system.
Sorry.
Clinical trial
Clinical
management.
trial management system.
Okay, what it contain? Any idea?
The system which maintains and manages the planning of the.
Ma'am, electronic record, electronic documents.
Correct. Okay. So Rahul, I know this is not correct, but to just boost their confidence, I want to show them a live CTMS. Is it fine with you?
Fine with me, ma'am.
Okay, fine. Are you able to see my screen? Just let me know, okay? Are you able to see my screen?
Now it
Yes,
is.
no.
Yes, ma'am.
Yes.
So
Yes,
this is
ma'am.
the CTMS. Okay. What is called? This is a CTMS. This is a different protocol which I am handling. Okay. For an example, if I want to go to the Roche protocol, I'll go from here. It contains all the information that how many countries are there, regions are there, sub-regions are there, whether they had been completed there or cancelled or progress. Okay. How many planned sites on the US, how many enrolled they are, everything is completed here. So here it complete the complete information. This is a CTMS where milestone, you know what is milestone? First patient, first visit here, that when this trial is completed in 2027. Okay, this is the milestone tracker here in the CTMS. Now coming back to your payment thing, I want to show it. Okay, so here is the payment activity here within the CTMS only. Okay, so right now I don't have an access here for the payment, but I try to show it. Wait a minute. I want to go to the particular site first. Just give me a second. Roche study. I'll go to America. Okay. I'll go to America. I'll go to this site. Okay. And then okay. I think I'm not having the access. I'm trying to show you the window. Okay, so here, like, you know, wait a minute. No, I'm not having access. Otherwise, I would have shown you. Okay, so here the detail will come, that subject number, payment has been done, status has been done, check, tax if it's deducted. This is completely a automatic system. That's what I'm trying to say that. And you know, the company will train you on this. Okay, and you can export a Excel from here. It's not like you have to manually enter anything in the Excel. Okay, so here the activity type, description, subject, screening, visit type, SDV completed, non-completed, source, status, everything you can drag it from here. Okay, so is it excited seeing the system? Yes, no?
Yes, ma'am.
Yes, ma'am.
Yeah. Have you seen this before?
No, ma'am.
Have you? Yeah. So yeah. It's good I have shown you, right? This is another protocol. So here you can see the accounts, contact, address, team history, who are the CRA, who is with, document tracking also we can do it, regulatory tracking, monitoring strategy, trip report review, okay, risk, protocol deviation, CRF tracking, see here. So you have to check it from here, and also you have to open the ECRF. See, screening has completed. See, are you able to see? See, source
Yes.
verified and source here, verified date. Okay, this all you need to check. Visit 1, visit 2, visit 3. Okay. See, this is the bill code. This is the payment ID they have generated. This is approved payment. Okay. So this all you will learn. See, ready to payments batch has been generated here. See, are you able to see
Yes,
this
ma'am.
dollars? This you need to cross check with the CTA, clinical trial agreement. See here, patient is dead because of this. SA has been reported here. Okay, that document also you need to check it. Got it?
Yes, ma'am. Yes, ma'am.
Is it exciting? See, you people are so lucky, you know, you are able to see the CTMS also. At my time, nobody has shown me even the ECRF also. Yeah, you should thanks to Rahul and Kamal, of course, for this. Okay, fine. So, am I clear on all the points?
Yes, ma'am.
You people are confident enough now.
Yes, ma'am.
Okay.
Yes, ma'am.
So coming back to point, when HR will ask about your introduction, your voice should be loud, not too low. Ayushi, especially for you. Okay. Please be loud when you are introducing yourself, because first impression is the last impression. So once you introduce yourself, okay, that itself you clear the half round of your interview. Okay, don't say myself is this. No, I am Sadaf Sheikh. I have completed this. My career aspiration is this, and why I have chosen to, apply for this position because of so and so reason. This is how you have to introduce. Don't go on basic. I have completed. They know that they have your CV, but how you are presenting it, that is more important. Okay, so present yourself very well with the confidence. Modulate, like, you should have that confidence in your voice. So if anyone will hear you, okay, this girl, this boy, they really have a confidence, they have a passion to learn. Good, they are hardworking and they have the patience to learn. So this impact a lot, because you don't I'm taking many campus interview. So half of the students I'm rejecting because of their confidence only. If you are not confident, then how I'm confident to take you for that particular role? So you should be so much of confidence. Introduce yourself with a different manner. Stop saying that I am this, I did this. No, like, try to articulate. You want any example in this, Samruddhi, Nikar? If you want, I can introduce in that way.
Yes, ma'am.
Okay, fine. So if somebody asks you, introduce yourself. So what you say? Hi, I'm Samriddhi Kulkarni. I have completed my clinic, my course, advanced, and whatever your experience if you have. Why I have applied for this job? Because I'm looking forward my growth in a clinical research, and I think this opportunity really suits me, because I'm seeing a lots of opportunity with this, and this is give a boost to my career, of course. And of course, this is a multinational company, and I love to explore it. Okay, don't feel like interview is like a viva. Okay, feel like how you're talking to me. In the same way, you have to talk with HR or the person who's taking your interview. Okay, not only in this interview, if Rahul is arranging another interviews also, other things, so talk in that way. Okay, and tell that, my career goal is this. I want to become this, and presently, why I choose my career as a clinical research because of so and so reason. If he or she is not asking also, please tell that. Okay. Yes. So first is your introductions, and then they will ask you what is clinical research. They will ask you about certain systems. And if you mention anything in your CV, like about your presentation, you have present certain things in certain colleges, or if you did any project, learn about it, because they want to check when you are giving your CV whether you have provided them in a provide them a correct data or not. Why? For an example, Priyanka will have added that she did some project in microbiology during her college time. But when I asked her, so can you tell me about your project? What was it? What was it outcome? What are the objective of that project? So you should be thorough with that. This is not, I want to, get that knowledge. No, because I want to check whether Priyanka has been added the correct information in the CV or not. Okay, so when you are adding any projects or any your achievements, thorough with it. Don't fake in your CV. For an example, who's this person? Again, I forgot the name. Who worked as a coordinator? Shubham. So if Shubham, you are adding something, you are worked in so and so therapeutic area for phase 1, phase 2, phase 3 studies. So be prepared that what was that therapeutic area. Okay. So what you did exactly as a CRC, what is your role and responsibilities? Okay. So thorough with your CV first. Okay. Prepare yourself very well with your CV and then go for an interview. Okay. Don't fake anything in your CV. If you already did, please remove that. If you are having zero knowledge about it, what you have written. Okay. Yeah. So Rahul, how is the usual process? Like you screen their CV and you will send it, or how is it?
When the CVs have already gone,
Mm-hmm.
and these 10 students, they will be appearing for the interview as per the schedule
Okay.
of Syneos.
Okay, so you will take the mock interview for them, or how it will be?
Mock interview, everything is over with them.
Okay, good. Fine.
The only thing, they were having some concerns regarding
Yeah, I know.
job description.
They thought it's related to finance, and that's what I want
Yes,
to clear
and
that
we are really thankful you have cleared all the doubts.
Yes.
And now they will not say that this is a finance position.
It is not finance, of course. It is. I have shown them a CTMS also, so now they understand. Like live data, I have shown them, so they must have understand this is not related to finance.
And I discussed the same thing with the HR of Syneos, and he was telling me the same. And he was even telling me they are not going to ask anything regarding to accounts and other things.
No.
They will test their clinical research knowledge only.
Yeah, because for the payment, they again, I'm coming back to the same point. They have to check the ECRF, they have to check the CTMS, they have to check the status of HDB, SDR. This is like a in-house monitoring job, if I can say in a short. It's a remote monitoring job. Okay, so yeah. Fine, Rahul. So any thing, Rahul, any other topic which you want me to discuss?
Thank you so much. Thank you so much, ma'am. And I think all of them, they are not having any question, any doubt. Yes or no?
No, sir.
No, sir.
Okay.
Just in
So
case, Rahul, if they are having still any doubt, or if they connect with you one-on-one and you are not able to answer them, please redirect to me. Feel free to redirect to me. I'm happy to assist them.
Definitely.
Okay. So best of luck, students, and be prepared. Okay. Whatever tips I have given, please use that. Okay. Be confident when you are talking with the HR or it's not like only HR will take the interview. There are the other panels also. So don't get scared seeing 2-3 people were asking the questions and all. Okay. Be confident. And again, this is not the end of the world. Okay, you will get lots of opportunities also. If you are not getting selected, don't get disheartened. Okay, Rahul is there, he will guide you for the other thing. But yeah, give your 100%. If it's not, it's okay. Might be better thing is coming on your way. So don't get disheartened in that way. Okay, don't. And first thing, when you are attending any interview, whether you are fresher or experienced, don't think that you want this job desperately. Don't show your desperation there. Okay, the moment you did, you will lose your confidence. Okay, am I correct, Rahul?
Yes, ma'am.
Yes. So don't show your desperation, and of course show in your career, and you desperately want this job, to start your career, but don't get in your mind, don't show desperation. अरे इसमें नहीं हुआ तो मेरा क्या होगा और ये होगा वो होगा. No, because the moment you think in that in your mind, you will lose the confidence. Okay. Fine, Rahul. So I think I have covered everything. And just in case, if students you have any doubt, please reach out to Rahul. He will redirect you to me, and I'm happy to assist you in that way.
Thank you, ma'am.
Thank you so much.
And God bless you all. Okay, and prepare well for the interviews. Maybe next week the interviews will happen. Okay. Thank you, ma'am. Thank you, everyone.
Thanks. Take care.
Thank you, ma'am.
God bless.
Thank you, ma'am. Thank you, sir.